called bone science? I don't know. How called the science?
What?
Syndesmology.
Syndesmology.
Bones. Arthrosyndesmology. Joints. Science of joints. Functions of joints. What functions you know? Movement, yes. What else? Not only movement, what else? What else? A lot of functions combine the bones to one unit, yes? Hold these bones near, yes? Hold all bones to one body near to each other. Next function, amortization. Amortization, this is soft the blow. For example, when you jump, a lot of pressure go to joints. So amortization, because if you not have joints, bones are friction. So amortization and perform bone growth function and physical properties of the joints, strength, elasticity, and mobility. And today we discuss classification of joints. Classification, we have three big group of joints. First, this is not synovial continuous joints. This is synarthrosis. Not synovial continuous joints, synarthrosis. This is membranes, ligaments, for example. Sutures, yes. Gomphosis, fontanelles. It's synarthrosis. Not synovial, not movement. Second group is hemiarthrosis. This group located between continuous joints and discontinuous joints. And the last group, this is diarthrosis. This is discontinuous synovial joints, knee joint, elbow joint, ankle joint, so movement joint. First group, how we say, this is synarthrosis. This is solid, not synovial, continuous joints. And we have three stage of development bone. First, connective tissue. Second, cartilage. And third, bone. So we have three groups of continuous joints. Fibrous connective tissue syndesmosis called cartilage, synchondrosis, and osseous, bone, synastosis. Three small group, one group, synarthrosis, have three small group. This is syndesmosis, synchondrosis, and synastosis. If we say about syndesmosis, this junction bounded by connective tissue. And first group, this is ligaments. Ligaments, this is a bundle that connecting bones to each other, yes, fix the bones, strengthen the joints, and limiter of movements. Limited, yes, the movements. And one example of ligament, we have ligamentum flava. It's called flava because have yellow pigment, yellow ligaments. Ligamentum flava located between arches of the vertebra. Ligamentum flava. Next group, this is membranes. This is plate that located between bones of upper limb and lower limb. Upper limb between ulna and radius, located lower fibula and tibia. Yes, fibula and tibia. Functions retain bones to each other and can serve as places of the beginning of muscle. Muscles can attach to this place. Then sutures, three types. We have in Latin sutura serrata, squamosa, and plate. Suture plate, it's flat. It's facial bones, plate. Then serrate, this is a lot of bones of skull between parietal and occipital, for example, parietal and frontal, and squamous between temporal and parietal bone. So we have three parts. Sutura serrata between a lot of bones of skull, occipital, frontal, parietal, for example. Squamous between temporal and parietal, yes, and plain facial. Maxilla, zygomatic bone, mandibular, nasal bone, all bones. And then next group, this is fontanelles. Fontanelles have only small baby. this is a plate that located between the bones of skull, fontanelles. No, I think you know.
Yes.
What is the fontanelles? Located between bones of skull. So we have frontal, occipital, sphenoid, and mastoid paired fontanelles. They closes by the 1 year. Closes. So adult people not have fontanelles. Only baby before the 1 year. And last group, this is gomphasis. Gomphasis located between teeth and alveolar socket of mandibula or maxilla. And periodont, this is a layer connective the teeth to the mandibula and maxilla. Periodont, it's called. So 5 groups we have in the syndesmosis, connective tissue, not movement, syndesmosis. Then second group, this is synchondrosis. It's cartilage tissue. Synchondrosis, and we have 2 types of cartilage, hyaline and fibrous cartilage. Yes. So example of cartilage, for example, we have discus intervertebralis that located between the bodies of vertebra, discus intervertebralis. Yes, and this is fibrous cartilage, discus intervertebralis. And for example, hyaline cartilage located between first rib and sternum. This is first groups, and synchondrosis dividing permanent for all life, discus intervertebralis, and temporary, yes. And then synchondrosis can transform to the syndesmosis. Synchondrosis then can transform to the synastosis. Yes, to the synastosis. Synastosis, this is the last group. This is bone tissue. An example of synastosis, coccyx, sacrum, and hip bone. How I say, the temporary synchondrosis transform into synastosis. For example, when before the puberty, human have 3 independent bone: os ilium, os pubis, os ischium. And this bone connecting synchondros. And during the puberty, yes, these bones make 1 bone, os coxa. This is synastosis.
Okay.
Understand? Yeah. Synchondrosis transform to synastosis. Or for example, sacrum. If we say about human before the puberty, this is 5 independent sacral vertebra that connecting synchondrosis. And then during the puberty, it's fused to 1 bone, sacrum. This is synastosis. 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 And then the next group. This is hemiarthrosis. Hemiarthrosis, this is group between continuous joints and discontinuous joints, and have a very limited movement. And example, this is symphysis pubica. Yes, located between 2 os pubis of the hip bones. And then the last group, synovial joints. This is synovial discontinuous joints movement, diarthrosis. In Latin, articulatio. And each joint have main structure, main parts, and accessory parts. If we say about main part, each joint have 2 surface, articular surface, yes, bones, articular surface. For example, the knee joint have surface of bone, surface covering the cartilage. Then we have a capsule around it, like a back capsule. Inside we have a cavity, and in cavity located synovial fluid. Liquor. Synovial, no, it is not liquor. This is like, how say? Wait.
Semi-fluid.
No, yes, synovial fluid. Main structure articular surface, facies articularis. It can be two, three, no, more often two, but can be three. Facies articularis, surface. Then we have articular cartilage covering the surface. Then we have articular capsule, cavity, and synovia, synovial fluid inside the cavitas. And then, if we say about first part, this is article, no, for example, shoulder joint, have two surfaces, caput of humerus and cavitas glenoidalis of scapula. And these two surfaces covering the cartilage. If we say about surface, they should be congruent. Congruent, it means corresponding to each other. And if they not corresponding, they covering the cartilage to make more corresponding to each other. So, surface cartilage. Next part, this is capsula articularis. This is encloses the articular cavity, like bag. And if we say about capsule, it have two layers. Fibrous membrane on side and synovial. And synovial membrane have synoviocyte its cells that produce the synovial fluid. Articular cavity, this is hermetically closed space. And synovial fluid, function of synovial fluid, moisturize the articular surface, reduces the friction, because if you not have a fluid, bones are destroyed. So it reduces the friction, nourishes articular cartilage, and softens pressure inside the joints. Soften pressures. In normal 1 or 2 millimeter synovial fluid we have inside the joint. So how many main parts we have? 5. Surface, cartilage, capsula, cavity, and synovial fluid. This is main. All joints, all synovial joints have these main structures. This is main structures. And we have additional structures. It can be or not can be. For example, ligaments. Function of ligament, they support, limited the mobility of joint, and we have two types of ligament: intra-articular inside the joint and extra outside. For example, knee joint have intra-articular and extra-articular ligaments. Then second part, we have disci or menisci. Disc, discus intervertebralis, today we discuss, located between the vertebra. And for example, menisc have knee joint. Disc have oval shape. Disc have located between sternum and clavicula, in articulatio in temporomandibular joint, and between the vertebra, for example, disc. And menisc located in the knee joint. The function of menisc, for example, make surface more congruent to each other, Next part, labrum or lip, articular labrum. For example, shoulder joint in cavitas glenoidalis surrounding, going the labrum. This labrum making more big place to caput. Caput more big than cavitas. So this labrum making more big area to caput. Understand? Mm-hmm. Yes. Articular labrum. And last, synovial folds, plica. We have synovial folds. And last, synovial bursa. Bursa, it's mean the back. Small pouch, yes. Small cavities. This is additional structures. And now we discuss movements. We have 3 axes: frontal, sagittal, and vertical. And in this axis we can make 3 types of movement. The first axis is frontal axis. We can make 2 functions: flexion and extension. Yes, in Latin flexio, extensio. If we say about leg, it's opposite: extension Flexion. Flexion extension, yes. Frontal axis. Second type of movement from sagittal axis. This is abduction and adduction. And if we say about arm, abduction only to the horizontal level. What located more up? Located elevation. Understand? This is abduction. This is elevation. Yes. Or leg, for example, abduction, adduction. In Latin, abductio, adductio. Abductio, adductio. And last, this is vertical axis. Supination, when palmar surface looking up, and pronation. Supination, pronation. Yes, vertical axis. Supination, pronation. If we say about foot, pronation, supination. Yes. And if we can make movement used all three axes, it's called circumductio. This is, for example, circumductio. Yes, this is can make only multi-axial joints that can use all axes in the movements. Так. Next classification. So on the Viva, when you tell about joints, you should say this is uniaxial, can make movements only in one axis. Uniaxial, biaxial, it's mean two, multi-axial, all three, many, yes, all three. And next classification, classification of joints based on number of the surface. Joint can be simple articulatio simplex. Simple, it's mean only two surface. For example, shoulder joint, how we say, discuss, have only two surface, scapula and humerus. So this is simple joint, first group. Second group, compound. Compound mean that joint have free surface. For example, the how called elbow? Yes, elbow joint have how many bones?
Three bones.
Humerus, radius,
radius,
ulna. So for characteristic, it's compound. Understand? Joint can be simple or compound. It's first two group. Next group, combined. Combined joints, it's mean when two anatomically separated joints working together. For example, temporomandibular joints, they are two working together all time. We can't working only one retromandibular joint. So this is combined joints. Understand? They anatomically separated but working all time together. Combined joints. And last characteristics classification group. This is complex joint. Complex, it's mean if you see the joint have disc or menisc, this is complex joint. For example, knee joint. Knee joint have menisc, so this is complex joint. Understand? Four group. Simple, compound, combined, and complex. Yes, four groups. And how I say, classification of joints based on axis movement, uniaxial, biaxial, and multiaxial. And in this group, we have joints divided to different shape. For example, first group, the trochlear joint. For example, this is elbow joint. For shape, trochlear, and uniaxial. Next, cylindrical joint. For example, radio-ulnar proximal joint, uniaxial. Only supination, pronation. Only one axis. Uniaxial. Cylindrical for shape. Cylindrical. Так. Next, biaxial begin ellipsoid. For example, wrist joint. Biaxial. Flexion, extension, abduction, adduction. Ellipsoid. Then condylar. For example, knee joint. Condylar. Biaxial too. And saddle. Looking when you horse have saddle. It's looking like saddle, so it's called sellar joints. For example, joint of first finger, like carpo-metacarpal pollicis joint, biaxial, and multi-axial, spheroid, for example, the shoulder. Because we can make all movements and circumduction too. Spheroid joints, then cartilage joints, hip joint, multi-axial too, and plane. Plane is flat for shape. For example, sacroiliac joint, multi-axial for movement, and for shape, plane. This is characteristic of shape. And about introduction of joints for today, this is all. So what characteristics can each joint? For shape, they are different. To movement, they are different. And they can be simple, complex, compound, and combined. Yes. And today we discuss the upper. Today we discuss the joints of trunk, columna vertebralis. Consists of how many vertebrae make columna vertebralis? How many cervical?
7 cervical, 12 thoracic, 5 lumbar,
Yes, and then sacrum, yes, and coccyx. If ligamentum flavum, ligament yellow, today we say about this, they located between the arcus vertebra of all vertebrae. Ligamentum flavum. At the next class, I bring, when we go to our forum, I bring you the joints. At the next class, okay? And show ligamentum flava located between the arcus, arches of vertebra. Then number 3, disc. Discus intervertebralis. Function of this disc, they prevent the friction. So unfortunately, the old people, vertebra is destroyed and they have pain in the spine. It's because vertebra is is destroyed and a very lot friction, and vertebra is destroyed too. So this is the young people don't have this problem, but unfortunately more old have. Discus intervertebralis, and each disc, if we're looking inside the disc, have a structure. Inside this is core, nucleus, core. For example, here planet have a core. Core. In Latin, nucleus. Nucleus pulposus. This is nucleus pulposus. And around going annulus fibrosus. Understand? Nucleus. One I ask because on the one picture I make this, and you should explain structure of disc. 2 parts have in the middle nucleus core, nucleus pulposus, and around annulus fibrosus. Annulus fibrosus. Next, disc we discuss. We have 2 ligaments. You remember that if we take vertebra in correct position, bodies looking in front, spinous process behind. And we have 2 ligaments. They run from all bodies of vertebra. Ligamentum longitudinale anterior and ligamentum longitudinale posterior. They run from cervical to lumbar vertebra. And then between the spinous process we have ligamentum interspinale and ligamentum ligamentum supraspinale. All of this I show you in the next class. Ligamentum interspinale and ligamentum supraspinale. This is all about. So columna vertebralis have a lot of ligaments and disc. And one joint, articulatio zygapophysialis. Articulatio zygapophysialis. This joint located between 2 articular process of 2 vertebrae. This is upper articular process of lower vertebra and lower articular process of upper vertebra. We discuss, we teach structure of vertebra. They have processus articularis superior, inferior, and between this process located the joint. It's called articulatio zygapophysialis, paired. 1, 2, paired. Characteristics. Simple. What means simple? Who remember? Simple. What mean? Simple.
Only two bones.
Yes, because have only two surface. Yes, two vertebra. Simple. Combined. Who remember combined? What
Two or
mean?
more.
Why? We say two articular surface. No, we say it's two. Why more? Two is simple. Once joint can't be simple and compound. Yes? Simple, two surface, compound, three or more. This simple.
Simple.
And combined. You confuse. Combined what? Two separately, anatomically separately joint
joints working
together.
together.
Are you see? They are two
Different
sides.
But they
Paired.
together.
And they are working
Working
together. They are
together.
created anatomically separated,
Separate.
Yeah.
but working together. So this is simple combined joint. Half disc, not. So not complex. You not see complex. Simple combined joint. For movement multiaxial, but this is amphiarthros. Amphiarthros, it's mean limited mobility. Amphiarthros. And for shape, plane, flat. Ligamentum plana. Or ligamentum, articulatio plana. So shape, it's flat, articulatio plana. Movement multiaxial, but amphiarthros. So on the exam you say, yes, it's multiaxial, but amphiarthros, very limited mobility. And simple and combined. Simple, because have only two surface, combined, but because two joint working together. Understand? This is all information about articulatio digapophysialis. And we, between occipital, atlas and axis, we have one joint. It's called articulatio accipitalis. And this big joint have 5 small joints. Articulatio accipitalis, occipital joint, connecting occipital bone, atlas and axis, multiaxial. And combined 5 joints. Paired Atlanta occipital joint, located between occipital bone and atlas. Yes, atlas. Atlanta occipital joint, articulatio Atlanta occipitalis, paired. I remember occipital have the condylus occipitalis, and
Condylus
atlas
occipitalis.
have fovearticularis
Fovearticularis
superior,
superior.
paired. So joint pair 2, articulatio Atlanto occipitalis 2. Understand? Because two sides have. For characteristic, it's simple. What means simple?
Two articulating
surfaces,
surface.
condylar and fovearticularis
Fovearticularis.
of atlas. Combined. What mean combined?
Because two
Yes, two sides working
working
together. Together, yes. For movement biaxial. Flexion, extension, abduction, adduction. Biaxial. And for types of movement, say combined flexion, extension, abduction, adduction. This is about Atlanta occipital joint 2, between occipital bone and atlas. And between atlas and axis, we have 3 joints. One median and 2 lateral.
Okay.
One median and 2 lateral. Lateral, it's called articulatio Atlanta axialis lateralis, and they connecting to articular process of atlas and axis. Understand? So paired 2. For characteristics, it's simple, 2 surface, simple, combined, working together, combined, and multiaxial. But this is amphiarthros. What mean amphiarthros? Who remember? Limited
movement.
Yes. And paired, like Atlanta occipital joint, pair 2. And we have one in paired, articulatio Atlanta axialis mediana, located between dents of axis and foveal dentis of atlas. I remember they connect foveal dentis and dents. We have only one dents. Yes, so this is in paired joint. So this is simple, yes, because we have only 2 surface dents and foveal dentis. Simple, and we can say combined because it's only one, working once. Simple uniaxial. This is rotation, looking to
Side to side.
sides. Understand? When you look to different sides, it's movement Atlanta axial median. And when you're making flexion, extension, abduction, adduction, this is Atlanta occipital joint. Understand? Atlanta axial median, uniaxial, only rotation to two sides. Understand? Simple uniaxial for shape is rhomboid and vertical axis rotation, only one movement. About occipital joint, this is all. Occipital joint is wide, but this is composed of 5 joints. 2 located between occipital and atlas, and 3 between atlas and axis. 1 medial, 2 lateral. So when they are working together, multi-axial joint, occipital joint. Understand?
Yes.
This information. And temporomandibular joint. This is temporomandibular joint located between caput of mandibula of condylar process and fossa mandibularis of temporal bone. Yes. This is paired joint. So this is simple joint, only 2. Fossa mandibularis and caput mandibula combined. What mean combined? 2 joints working together. Yes. Complex. What mean complex?
There's disc.
Disc. Yes. This joint have disc to make to surface more congruent. Because without this disc, fossa mandibularis and caput not correspond to each other. So this joint have disc. So this joint have 3 characteristics. It's simple to surface, combined working together, and complex. For shape, condylar, processus condylaris because of mandibular, yes, and multi-axial. We can close and open the mouth, forward, upward, and 2 sides. Multi-axial, and half disc. And 2 small joints last for today. First, sternoclavicular joint. Articulatio sternoclavicularis. If we say about clavicula, what part connecting with the sternum? Who remember?
Extremitatis sternalis.
Yes, and sternum have incisura clavicularis. So this is simple. This is 1. This is paired. 1, 2, paired. No, this picture is closed ligament. In this is open. Ligamentum sterna clavicularia. Simple to surface have sternoclavicular. Combined because this joint working with acromioclavicular joint. Remember, sternoclavicular and acromioclavicular all time working together. They can't working separately. How say? Yes. They working only together. Acromioclavicular and sternoclavicular joint. Yes, and complex have disc. Simple, combined, complex. For shape is salar, because looking horse have a sail, yes, and multi-axial, sagittal upward and downward, vertical forward, backward, and rotation of clavicula, rotation. It's first, and this joint have a ligament. Ligamentum sternoclaviculare, ligamentum interclaviculare between 2 clavicula, and ligamentum costoclaviculare between first rib and clavicula. These ligaments support the joint and limited the mobility of joint. Ligaments teach too in the Moodle. You have presentation and PDF document. So in this PDF document, additional information located. This is sternoclavicular, and last for today, acromioclavicular joint, articulatio acromioclavicularis. Acromion of what bone? Acromion.
Scapula.
And extremities acromialis of clavicula. Who can say me simple characteristics? Simple,
Two surface.
combined, working with sternoclavicular joint, not have disc. not complex, not disc. Only sternoclavicular. Acromioclavicular not have disc. Multi-axial, amphiarterous. What mean amphiarterous?
Limited movement.
Yes. Plain for shape and have ligament. Так. Ligamentum trapezoidum attached to linea trapezoidea and ligamentum canaidum tuberculum canaidum. But the clavicular, the inferior surface, we teach linea trapezoidea and tuberculum canaidum. To these places attach the ligaments. And you see how we used them.
Yeah.
Muscles then attached to have soul, teach bones, and then joints. And upper limb, next class we discuss. All who can open me the Moodle, I show you what information, yes, you can use at home.